app. Okay, this is a doctor's portal. Or any senior nurse or anybody who is trying to use the portal. So this is the portal here. Okay, when you log in, you see the statistics. No, how many patients have been tested today, 7 days, 30 days, all those stuff, and how many patients are added and not examined. And no, who are the recently examined patients? Okay, I'm going to the XYZ demo where we did the demo 34 minutes ago. So these are the reports. See, I took the picture of the cardio sleeve and all those stuff. Okay, so these are the reports generated, and we will find out based on the reports. We can this is the visual examination. This is the drug test. So rapid tests. The rapid test means the combo and influenza, HIV, or all these tests can be point of care tests. Okay, then urinalysis, it will give all the reports here. Blood glucose report here. And this is the peak flow meter report in color coding. Okay, likewise, these are the tests we did. I will show you, this is the actual report done at the field level. I will show you the actual report done at the field level. Okay. See, these are the vital signs here, practically done at the field level. So you see the blood pressure in yellow, so you will see that it is little high, and rest of the things are green. Then you will see the peak flow meter report. Peak flow is in red zone because they attained to 0 values for 2 of the parameters. So peak flow also, it will show whether the lung capacity is in green or red. Okay, and then the blood glucose report here, it shows red here. Then the lipid panel, which I did not show you, this is the lipid panel report. This is also point of care. So everything color coded again. It will show total cholesterol, HDL, LDL, and triglycerides. Okay, and then visual examination. So they did the eardrum test. They captured the pictures, eardrum pictures. So here you see the eardrum, very clear eardrum. And you see the perforated one here. Okay, now the auscultation. Auscultation means, which I showed you. I will show you the report here. See, these are the reports for all the 4 valves. So this is for one of the valves. What I do is I am doing if the doctor wants to examine the ECG of that particular report, he will look at the ECG. But doctor will look at this report only when there is red. So if it is green, there is no necessity for the doctor to look at the reports. So if the doctor wants to deep dive into the ECG and see what is happening about the curves, so he can do this. Also, they can look at the heart sound report. These are all called S1, S2 nodes. So doctor wants to see deep dive into the report, into the heart sound. He can look at the graph. Likewise, doctor can hear the sound, a heart sound at full speed. I don't know. I think, are you able to hear the heart sound?
Briefly.
Yeah, and also he can hear the heart sound at full speed and half speed. Okay, all the parameters are here. This is auscultation report. Auscultation is nothing but heart murmurs. That means any leakage from the heart valves. The next one is 3-lead ECG. Lead 1, lead 3. As you know, if anything abnormal, it will be shown in the red color. Okay, likewise, you can see the ECG here. Now, if the doctor wants to have a close look, they can have a close look. Now coming to the cardiac function, which is, as you know, we are the cardiosleeve is the first device in the world to measure this, to do this screening. So we are the first ones. That's why we got the patent, as you know. So here we are displaying four parameters. The first parameter indicates if there is any heart failure. The second parameter indicates if there is any premature heart failure. That means the heart is about to fail. So we can find out premature heart failure 6 months at least before someone could be identified in echocardiogram. Okay, before they can identify on an echo, we can find out that there is a premature heart failure. Okay, this cardiac function test is equivalent to ejection fraction in echocardiogram, 2D echo, what we call 2D echo or 3D echo, whatever it is. So the first one is heart failure, the second one is premature heart failure, the third over length of heart wall, the heart tissue, the overall strength of heart tissue. The fourth one is the present condition of the heart. Okay, I think I hope you understand, or if you have any questions, please let me know.
Okay. All right. Yeah. Do you have any question? If you have, over to you.
Yeah, sure. So I'll go to the next one. So likewise, there are four parameters we are screening about the heart failure. The next one is urinalysis. It will give the reports here. And the visual examination, we do the breast screening also. We have the breast screening, this one also. Here you see there is no lumps or any abnormalities in the tissue. Okay, this is a basic breast screening. If you find any lumps or abnormal tissues here, you will refer them to the next level. Okay, this is all about the practical which was done at the field level practically. So now I'm going back to the reports. I will show you the reports, practical reports. So this is the reports generation. This is a full report generation. The first one is vitals. Whatever I showed you just now, this is a report for that examination. The first one is vitals. You will see the vitals risk index here. Okay, the patient has everything in green except the little bit blood glucose, high levels, little bit high. So this is the first time the patient is tested, but if the patient has previous records, then that will be displayed here. Okay, so that the doctor can easily understand what was their previous reports 4 times in the past and what is the present report. And the next one is auscultation report. That means heart murmurs, any leakage from the heart valves. So it will give the report like this: ECG, heart sound, and this is called spectrogram. Those doctors who can read the spectrogram, they can read this. This is a mix of both ECG and heart sound. Okay, this is for the four valves. So I'm passing through all the valves, four valves. Next, the one is ECG report. You will see the 3-lead ECG, lead 2, lead 3, and lead 1. This is a report for ECG, and it will show green and red where the intervals are more. And the next one is cardiac function report. As I explained, there are four parameters. Okay, and we have given the explanation also here for the people. Since this is a new technology, so we have given the explanation to them. Okay, and this is the cardiac function report, waveform, ECG, heart sound, and spectrogram. Then the spirometer, which is the lung function. This is a report for it. Okay, and the blood glucose report. Then the patient lipid panel report, urinalysis report, Okay, visual examination report. So visual examination report. Okay, this is the report. So it has a 16-page report. So we have a small report also. It's a 5-page report. We have 5-page report too. So this is the deck I explained you in over the phone. Okay. Now going back to the portal, I'll walk you through the menu here, menu. So you see the demographics, we have all the patient details here. Encounters will have all the reports. Note, they will write SOAP notes, subjective, objective, assessment and plan, okay, about the patient. Okay, and the prescription, if the doctor want to prescribe, like here, they can add the prescription. Okay, they can add the prescription here, and what do you call? They can email it. Sorry, they can email it. They can send a text message or print the report and give it to the patient on the spot with their digital signature. Digital signature will also be added like this, and the HX is the medical history. If you want to add any medical history of the patient, so this is the standard medical history used in US. So we have present history, past history, family history, okay, systems review, women's reproductive history, so all those stuff. So we have we will enter the history here. Then if you want to upload any documentation like previous reports or any x-rays, we can upload here. Okay, then the time shows now what is the time spent for the patient, for the review and all those stuff. Okay, this is all about top menu, about the reports. And coming to the medical intelligence, I'm going on the left-hand side. I'm going to insights, where you will see all this medical intelligence. For example, a doctor has 500 patients. Once all the 500 patients are on the screen, or a village factory, so once it will all those. If you click BP, all the BP. Let us say there are about 500 employees, and you got the statistics here. You click all abnormal BP patients and send a mass text message to them saying that there is a specialist coming to the clinic. Whatever message, any push notifications, you can send it. Likewise, all pie charts, these pie charts you can select and deselect, and you can find out the relevant patients at the bottom. When you select all the abnormalities, that means those patients are very critical patients where the doctor needs to provide more attention, right? More visits and more, they have to close watch those patients. So selecting all, you can do that. Okay, when going to the patients, it will list out all the patients with all abnormalities in the descending order. Maintenance are going on the back end. That's why it's little time. Go back. So this screen will give you the patients in the descending order, and that means the patients, those who have more reds, on the top, and it slowly goes the patient with no issue. Okay, in the descending order of the issues. So at the skin level, you can find out which the patient has, what problems the patient has. And the bulk upload, which I discussed, see, you can add a new patient here, or you can import patients just by an extract. So if you want to screen an industry with 500, you get details and upload. All the 500 employees will be uploaded. This is a bulk upload. Okay, and likewise, if you want to send text message to all patients here, every patient, you can send a text message. Any push notifications you can do. So these are all about it. Then launch the video. From doctor's point, if they use iOS, they can do a FaceTime right now, or else they can launch video using Skype, or we can also provide a dedicated video, okay, about the video. And my account is general and logout is okay. So now when you click on a patient here, again, it will take us to the reports. You can email the reports here, and we can, this is the long report and this is the short report. 15 pages, short report will be in 5 pages. So this is all about the backend web portal, a small HIS system. So hospital information system where you can prescribe, you can have notes about the patient, you can have all EMR, you can have the history about the patient, and you have the medical intelligence and all the stuff. Any questions?
All right.
Yeah.
Yeah. Okay.
Yeah. Thank you very much. Please, members, if you have any question, but maybe before you come, let me ask: how averagely, how long do I spend on a patient with this device? How long in getting all the things I need?
That depends. For example, I showed you vitals. I showed you the dashboard in the application, right? So to do the vitals, the time is 3 minutes to do the vitals at the field level, and to do the all cardiac functions, like checking all 4 valves, lead ECG and cardiac function, it's 5 minutes. Check all the 3 functionalities. Okay, lung, if you want to check lung, it's about under 5 minutes. Okay, the blood glucose and all, it's about 2 minutes, 3 minutes, or no, it will be around, on an average, if you want to do all the tests, then it will be around 20 minutes for a patient, if you want to do all the tests.
Okay. Thank you.
Okay. At the doctor's level, if you want to see the patient, doctors, as I said, doctor will see only when there are reds. Even if you see this patient, for example, the cardiac function is good. Okay, I don't need to get in and open the ECG and heart sound. I don't need to do that because it's green. Okay, and he has no issues at all. Either present heart failure or premature, nothing is there. Okay, likewise, 3-lead ECG, all the 3 leads are green. So though it's a little red, it doesn't matter. So I don't need to see this. Auscultation is perfect. I don't need to look at the auscultation reports because everything is green. So even doctors, they don't need to look at they don't need to continuously monitor this website. Even a senior nurse can also do this. Okay, or anybody who trained can do this. See, I'm an amateur now. For me, the system already decided what is the status of the patient. So for me, there are some reds here. I go there. I see that the BP is 176 by 110, which is high because the diastolic pressure is 110. So it shows 10. The vital risk index is 10. So the nurse will automatically either refer to this doctor or she can change the medication or whatever, if she can take a call, she can take a call. Likewise, it saves the time at the field level and as well as at the periphery level. And everything is authentic. Everything is reported. You have EMR, electronic medical records of a patient, as a proof that, of course, those legal things are, as you know, they are very prominent in US and Australia and all those countries, right? So they have a record. Doctor have a record that he has all the records here with what do you call with the analysis.
Okay, thank you. I think when we went to Zoom, all my clinicians were not able to come on.
Yes.
But I have some nurses. Abigail, your mic is you haven't connected your mic, so you can't ask any question. I've seen that. Mr. Aja, do you have any question? Unmute your mic. Georgina, if you want to ask any question, unmute your mic.
Director, I have no questions at the moment. Thank you.
No, okay. Okay, so you are fine. Bridget, any question? Unmute your mic before you can speak.
No questions, sir. Thank you.
Okay, so it means that all of us have understood. I think it's a good device to be able to reach out to many of our folks in the hinterland in terms of sending good healthcare to them. So, but I think we have all bought the idea, and we thank you very much. Is there a way of adding up, if there is the need to add up some queries somewhere on the device? Is it that robust to add up, or what you give us is what we have?
No. We can add. See, most of the things, once you go through this, we are covering most of the stuff. But still, if we need to add something at the application level, we can add. No, that's not a problem.
Okay.
So I'll just, so what exactly you mean by add doc? You want us to add some device or some diagnostic tool here?
Yeah, something like that.
Okay, so if you let me know what exactly you're looking for, let's say you're looking out for a point of care ultrasound, so we can integrate it here, we can add it here. Yes.
No, in case maybe there's a kind of test I need to do, you haven't added it. So can I add so that there's a device to connect to it? Or for now, I'm just asking generally. I may not have the specifics now.
So you let us know the kind of a device that you want to integrate or add. We can see. That can be added.
Yeah, because as you know that first of all, we need to identify whether it is a Bluetooth or manual. Those things are there, right? So once you let us know, so but it's to say that openly that anything can be added. It's like a plug and play platform.
Okay. Okay,
Yeah,
I get you.
so yeah, it's like a plug and play platform. But again, if the device emits Bluetooth and works on Bluetooth, then it will be an automated report. Otherwise, we need to enter manually.
Okay. Okay. I get you.
Yeah.
Amen.
Yes. Okay. I think that is it. And at least all the features have been presented. You guys will need your feedback so that we can also go forward with Sanjay and Balaji as to how best we can deploy it in your environment. And you have seen it all. In case you go back and there are some questions, we are available. Shoot us an email to your director, then we can all answer it and then see how best we can have it deployed in whole for you guys.
Oh, absolutely.
Thank you very much.
So just a parting question, sir. So which are the clinical use cases where you are deploying these devices?
Sanjay, your mic is faint.
Okay. So which are the use cases, where you like to go for a clinic in a bag?
I hardly get you, but
So which are the clinical use cases you program, or you want to put it at some health centers or kind of a door-to-door clinic?
In other words, do you guys want to start afresh, or you like to migrate some of the stuff you have now onto this system?
oh, no, in terms of migration, what do you mean there?
Like, do you have similar results you like to start with it, or you want to use it as a fresh system, entirely?
No, I think we have some cloud here. Well, we don't know whether we can sync it.
Okay.
But we don't know whether we can sync that one with it. But if not, we can have it fresh and start.
Okay.
Okay. All right.
So maybe basically it calls for understanding your system, and then this system, and then how it can be synced. Either they require another software to do that, or it can easily be done. Whatever, that will be another stage. All right.
Yeah. So I had my IT manager on it, but I think when we came to Zoom, I've lost most of them.
Yeah. Okay.
I wanted him to deal with such an area, but he's not here.
Okay.
Right. Perfect. So you let us know in case your IT person has got some questions on that.
Okay.
All right.
Okay.
And,
I'll let you know later.
Yeah, and we'll be happy to answer. And you also let us know the kind of a devices which you add to this. Kind of a devices which you like to add on to this. We can do that also.
Okay. All right. Okay. Thank you very much. If there is no question, maybe we have to end here. I want to say thank you so much. And we believe very soon everything will be done, and we can also